Today I'm going to be talking about the different types of intermittent fasting, the science behind why it improves longevity. I'm going to give you some options for intermittent fasting, and at the end, I'm going to tell you which one works best. All right, welcome back to Citizen Surgeon. Let's do it. I'm so pumped you're here today. My name's Dr. Eric Pearson, and I am continuing the longevity series here at Citizen Surgeon to talk about intermittent fasting. And we're not just talking about intermittent fasting. We're not talking about diets. We are talking about this in the scope of longevity. So how does intermittent fasting affect longevity? Now, there is a lot of research out there. There's a lot of research in animal models, and there's a lot of research in humans, and we're going to be talking about that, okay? But first, we got to understand what intermittent fasting is and what the different types of intermittent fasting are. So check this out. First, we have alternate day fasting. Now, this is where we have eating days with 125 to 150% of daily caloric need, matched with fasting days where we have very little, less than 25% of energy intake. A second type of fasting is time-restricted fasting. And when somebody says intermittent fasting, this is most likely the one that you're thinking about. And this is where we have free energy intake within a controlled time period. So that means we're eating for 6 to 8 hours, or we're fasting between 16 and 18 hours each day. And then a third method is the 5 to 2. And that's where if we take a full week, we're going to eat normally for 5 days a week, and then we're going to be fasting or having very low calories for 2 non-consecutive days. Now, towards the end of the video, I'm going to talk about which of these is the most sustainable and also which one is the most effective. Now, there are other fasting regimens out there. There is a fasting mimicking diet, which is very low in protein, low in carbohydrates, and that leads to ketosis, which can mimic some of the effects of fasting. There's also prolonged fasting, and that's if we're fasting for greater than 24 hours, and that's not something we're going to really talk about here until we get to the end, and I'm going to show you some combination fasting regimens. So let's get into this question. So when we think of intermittent fasting and longevity, what does it do? How does it affect longevity? Well, the first thing is that it improves cellular repair and autophagy, or autophagy, however you want to say it. Okay, so how does intermittent fasting affect cellular repair and autophagy? Well, first we have to understand what autophagy is. And if we break it down, auto means self, phagy means eating. Okay, so self-eating. Well, why would we want to be self-eating? As cells get to the end of their lifespan, they become senescent, and they're just hanging around without much function. And when the body doesn't need cells, it will eat itself. It will digest those cells. And so autophagy is the body's way of getting rid of non-functional senescent cells. Well, how does this happen? So autophagy can mitigate cellular damage because it's removing non-functional proteins and non-functional organelles. So this is going to reduce oxidative stress. That's going to also reduce inflammation. Autophagy is also important for energy regulation. So in times of nutrient scarcity, okay, so during fasting, autophagy can digest cells and get building blocks for energy production. When we look at disease, specifically neurodegenerative diseases like Alzheimer's disease and the buildup of beta amyloid and misfolded proteins, autophagy is impaired in patients with neurodegenerative disease or some neurodegenerative diseases. And if we can improve autophagy and we can improve the removal of those misfolded non-functional proteins, we may be able to help prevent or treat neurodegenerative diseases like Alzheimer's. And finally, we need to talk about the pathway. So how does autophagy improve longevity? Well, when we get down to those cellular processes, the central figure in all of that is mTOR, okay? And that is target of rapamycin, and that is present in humans, also present in animals. So this target of rapamycin has two subunits or two complexes. That's mTOR C1 and mTOR C2. And if we're going to get down to the details, it's mTOR C1 that has the greatest effect in longevity. And so let's go through a few of these pathways. So mTOR, or mechanistic target of rapamycin, is a protein kinase that is critical in cellular growth and metabolism. When we have a significant amount of nutrients, or we have growth factors like insulin-like growth factor, or we have cytokines and inflammation, these activate mTOR. And so what are some of the endpoints of mTOR as a protein kinase in the metabolic pathway? Well, one is protein translation. So if we have abundance, if we have a lot of nutrients, mTOR is going to be activated and we are going to make more proteins. We're going to be anabolic. Now, since we are anabolic and we're in a period of cellular growth, we're going to inhibit autophagy, and so we get cellular senescence. We get an abundance or an increase of those cells that are senescent and non-functional. We also see increased stem cell turnover, so we need to produce more cells. We're in growth, and mTOR can increase inflammation. So all of these things in red are not so great for longevity. We want to stop these things. So how do we do that? We do that by inhibiting mTOR, or mechanistic target of rapamycin. And so how do we do this? Well, first, when we look at fasting, we're going to decrease nutrient availability. Okay, now decreasing nutrient availability, that happens after glycogen stores are depleted. That takes 12 to 16 hours in a fasting episode. Okay, and if we're going to decrease glucose, we're going to decrease amino acids, particularly leucine, we are going to decrease or inhibit mTOR activation. Now, if we inhibit mTOR, we are going to promote catabolic processes like autophagy. A second pathway, if we decrease nutrient availability, we are going to increase the adenosine monophosphate to the adenosine triphosphate ratio. Okay, those are really important in metabolic processes. Okay, that might bring back nightmares if you're a medical student, you're remembering glycolysis and the Krebs cycle. Okay, but we're going to tone it down just a little bit in this discussion of longevity, but we're going to increase that AMP to ATP ratio, and that is going to stimulate AMP kinase. Now, AMP kinase is important because it's a cellular energy sensor, and it's going to be stimulated when energy stores are low. And so we see this during fasting. We also see this during strenuous exercise. And so if we're stimulating AMP kinase, this is a signal to the body that we can't be anabolic, that we need to break things down. We need to be catabolic, and so we need energy production. And so what does that look like? Well, when we look at the body in periods of fasting or periods of strenuous exercise, we're going to want to increase glucose uptake to the tissues that need it. We are going to promote fatty acid oxidation. We are going to inhibit lipogenesis, or the formation of triglycerides. And we're going to also suppress protein synthesis. Now, one of the other functions of increasing or stimulating AMP kinase is that we're going to inhibit mTOR. And if we inhibit mTOR, we're also going to get all of these things that are now catabolic and are promoting autophagy. Now, if I can throw one more in there, what is something else that happens when we decrease nutrient availability? Well, we are going to decrease insulin, and we're also going to decrease insulin-like growth factor. Insulin-like growth factor is a promoter of mTOR. Okay, so by decreasing that, we're going to decrease that stimulation. By decreasing these growth factors, we're also going to inhibit the PI3K AKT pathway. That's going to further inhibit mTOR. So we have multiple ways of inhibiting or decreasing the stimulation of mTOR, which is going to promote catabolism. It's going to promote fatty acid oxidation. It's going to inhibit protein translation. It's going to inhibit lipogenesis and promote autophagy. So now that we're comfortable in understanding that autophagy is linked to intermittent fasting, okay, and I can put some really nice resources for further reading down in the show notes, okay, but now that we're happy that those two things are linked, And we're getting autophagy, and we understand now that there are a lot of reasons why that is beneficial to health and beneficial to longevity. We got another word, and that word is hormesis. Now, when I say hormesis, you're probably thinking cold plunges, or you might be thinking saunas. But hormesis is just a mild stress to the body, and mild stress to the body is good. Mild stressors like caloric restriction, exercise, cold exposure, heat exposure, mild oxidative stress, these are good stresses because they promote cellular resiliency. They also promote cellular repair, and these things are important when it comes to longevity. Now, the important thing about hormesis is it is stress, but it's not too little and too much. It's like the three bears. It's the sweet spot. Okay, so if we have too little stress to the body, we're going to have stagnation, right? If we have too much stress, we're going to have oxidative damage. So hormesis is exposing the body to a mild stress, and the body will respond by improving these cellular repair mechanisms or improving cellular resiliency. Now, how does hormesis do this? Well, there are a ton of different pathways. That could be through inhibition of mTOR. It could be through improvement of mitochondrial health. It can be through the FOXO pathway or heat shock proteins, HSP, down below. And if we look at this table, it's going to show you what hormesis pathway is activated by a particular stress and how that relates to longevity. So check this out. When we look at this table, you can see that caloric restriction, the pathways that are activated are AMPK. Now remember, AMPK is going to inhibit mTOR. Also the sirtuins, mTOR itself is inhibited. And what is this effect? This leads to increased autophagy and reduction of inflammation. We can look at a few other things like exercise. So AMPK is activated, NRF2, and mitohormesis, and this leads to improved myocardial function and reduced oxidative stress. Now finally, AMPK is activated by intermittent fasting, sirtuins, and FOXO, and this again leads to improved autophagy and stress resistance. Remember that stress is not a bad word, and if we can find that sweet spot of stress, this can be greatly beneficial and very powerful when it comes to longevity and metabolic health. And so I've touched a lot on autophagy, and I've touched a lot on these pathways and how intermittent fasting can inhibit mTOR. Well, what are some of the other benefits when it comes to intermittent fasting? And I'm not talking about weight loss. I'm not talking about diets. Well, it does. I mean, I should say that. It does for sure help maintain a healthy weight because intermittent fasting is related to caloric restriction, okay? And that, as you can see in the last slide, does have effects for activating AMPK pathways, sirtuins, and inhibiting mTOR. But there are other benefits. So let's look at these other benefits. So we have autophagy. We have decreased insulin-like growth factor, okay? If we have increased insulin, we can get insulin resistance, and we see that in type 2 diabetes. We have improved mitochondrial health in intermittent fasting, and I should say that this is all science-backed and evidence-guided. And again, I'll put those references in the show notes below. There is a reduction of inflammation with intermittent fasting. It is a type of hormesis. Remember, we talked about saunas and cold plunges to get that sweet spot, mild stress, and intermittent fasting is another way that we can activate those pathways. The microbiome is improved. We get a better microbiome or bacterial balance in our gastrointestinal tract, and we get stem cell activation. So intermittent fasting does a ton of different things in the body. It's not just a fad diet, okay? So there are a few different ways that we can do intermittent fasting, but which way is the best? Is when we look at alternate day fasting, or we look at intermittent fasting, or we looked at 5-2 fasting, what's the best one? Well, at the end of the day, the best one is the one that's right for you. It's a very personal decision. So what one is good for your health and what one is one that you can sustain? So if we look at alternate day fasting, we can see that this has profound autophagy compared to time-restricted fasting. Okay, it's highly effective for insulin sensitivity, reducing inflammation and lowering oxidative stress, but it's really hard to maintain. All right, you eat one day and then you're not eating anything the next day, and that's very difficult for sustainability. It can also trigger hypoglycemia and some other metabolic issues in people that would be prone to that. And I'm going to talk about those individuals in the next few minutes. Well, let's look at time-restricted fasting. Now, the nice thing about time-restricted fasting is the evidence would say that this is the most sustainable. Now, if we can get ourselves on a good program, we can do time-restricted fasting almost every day or on most days. And so autophagy activation after glycogen stores are depleted, more sustainable than alternate day fasting, and especially if combined with exercise, time-restricted fasting can be effective. Now, how about that 5-2 method? So that's when we're going to be eating normally for 5 days, and then within the week, we're going to have 2 days where we have almost no caloric intake. And so how does that compare? Well, we do get some autophagy activation, but this is much less pronounced than alternate day fasting, and this tends to be quite unsustainable as well. So if we're looking at sustainability, time-restricted fasting is generally the best option and is the easiest to do. Even though it's not easy, it's the easiest for most people to fit into their daily program. So we've talked about alternate day fasting, we've talked about time-restricted fasting, eating between that 6 to 8 hour window, fasting for 16 to 18 hours. Okay, well, how about a combination approach? Well, a combination approach of time-restricted fasting on most days while throwing in a longer period of fasting, say 24 to 48 hours, can have profound effects on cellular health, regeneration, resiliency, and longevity. Now, I need to exercise a little caution here. And so, who needs to be cautious when it comes to intermittent fasting? Now, this is important because not everybody is a candidate to do intermittent fasting, whether that's for weight loss or for longevity. So, pregnant women and women who are breastfeeding should certainly avoid intermittent fasting because they need all of those nutrients to be in an anabolic process because they are truly anabolic. They are creating another baby or feeding a baby. People who have uncontrolled diabetes, who have nutrient deficiencies, who have mental health problems, who have eating disorders, who are unable to maintain a weight, those people should be very cautious when starting intermittent fasting. Also, children, people at advanced age, and people on certain medications should be very cautious when it comes to intermittent fasting. And so if you have any questions, make sure that you contact your healthcare professional. And then there are groups of people who not only should be cautious, but they shouldn't do intermittent fasting without talking to their doctor. So people with type 2 diabetes, people with thyroid problems, women with hormone problems, people with mental health issues, and even athletes performing at the very top level should consult their physician before starting an intermittent fasting program. And then finally, when should you say stop? Let's say you're doing intermittent fasting and you notice any of these things. So weakness or dizziness, unintended weight loss, worsening of any particular medical condition, if you're having a nutrient deficiency because of the fasting, or finding yourself having poor or challenging concentration. If you notice any of these things during intermittent fasting, then you should stop and talk with your healthcare professional. Well, I hope you enjoyed that today. I'll tell you what I do. So I do about a 16-hour fast. All right. So how does that work in my life? So I'm a pediatric surgeon. I operate most days, and my eating window is from about 1 p.m. until 8 p.m. All right. So I have a 7-hour eating window, and then I don't eat again after 8 p.m. until the next day. I eat at around 1 p.m. Okay. And so during that period, I'm drinking coffee in the morning. I take medications that I need to take and supplements in the morning. All right. I also take AG1 in the morning. That has been my staple for years, Athletic Greens 1, and it is a fantastic source of vitamins and minerals that I need every day. usually work out in the morning and then just drink water after that. And then my first meal is at 1. Now, when do I break up that cycle? I'll break up that cycle if, let's say I'm going to start a big case at 10 in the morning. And that case is going to go for 4 or 5 hours. Then I will break my intermittent fast. Or if I know that that's going to happen, perhaps I'll eat or stop eating a little bit earlier, say have my window stop at 5 p.m. the night before, because I don't want to be hypoglycemic and dizzy or having poor concentration if indeed I'm in a big surgery case. So that's my routine. I hope you enjoyed this today. I think intermittent fasting is fantastic. I actually really enjoy those hunger pains, that hormesis that I'm getting with intermittent fasting. So definitely give this a shot if you're interested. If you don't have any of those caution signs or you don't have any of those stop signs, then try it out and see how you do. See if you like it, because this can not only have a profound effect on maintaining a healthy weight, but it can have a profound effect on longevity. So in this longevity series, we talked about what longevity is. All right. We talked about having a health span rather than a lifespan. All right. And today we talked about intermittent fasting. In the future, we're going to be talking about supplements and exercise routines and all sorts of stuff. So if this is something that you enjoy, make sure you like and subscribe. Share this with your friends who may be interested. Leave a comment below. I love engaging with you guys. And if you want to enjoy the community at Citizen Surgeon, we have not only medical students and residents and surgeons, but people in the population that are just interested in medicine and health. So I look forward to engaging with comments. As always, stay safe, study hard. I'll see you next time.